Yeah, small labral tear. Yeah, you could see that in the imaging too.
Yeah.
Yeah, and the foot is a pretty bad fracture for sure. I imagine you probably think the stem cell will help the shoulder more than the foot because it's less serious.
Yes.
Yeah.
Let's take a look here at your shoulder.
And by mixing the stem cell with the exosome, what does that do? Because I don't think I've ever actually had that done yet. So
Yeah, so that's going to actually, the exosomes, as you know, are like the messengers from inside stem cells. So it's just going to enhance and magnify the effect, decrease inflammatory processes, kind of stimulate the regeneration and healing process, things like that.
Okay.
This will be warm. I'm going to...
And Jenny was mentioning that I might be getting NAD tomorrow, and she said the NAD might actually help the effectiveness. Is there a philosophy behind that?
Yeah, so NAD has been shown, to do quite a few things: increase energy, cognitive ability, blood flow, and also some regenerative and repair. So all these things kind of stimulate your body's own ability to heal, as well as the actual cells and exosomes can go in, land on the damaged and injured tissue and try to regenerate tissue. Okay, that's a good image there. That's right where we're going to go. All right.
What do you see there? For a layman like me.
Okay, so this is you can see the two kind of curved lines.
Yeah.
The space in between is your joint space, and there's a little notch on the bottom. Let me find it again here. Right on the bottom when there's a little notch in there is where we're going to go.
Okay.
Okay, that's right. And so we put this in the joint space. The cells will actually move throughout the joint space, be attracted to any injured or damaged tissue.
Okay. So the little thing that shows as a knot is the tear.
Well, I don't really see the tear on the ultrasound. I'm locating where I'm going to put the cells.
Okay.
I saw the tear on the MRI images that you had.
Right.
Let me get this out of your way here.
Yeah, if you need me to take it off, I could take it off.
I think we're okay. I just don't want it to...
How long have you been doing the regenerative medicine therapy?
About 4 years.
Okay.
I did emergency medicine and family medicine for 40 years.
Oh, wow. What's the most serious emergency that you had to deal with that you were able to save someone on?
Butcher knife in the chest.
Oh, God.
Yeah. We had a lot of gunshots to the head. They didn't survive.
What town was that?
Dayton, Ohio.
Dayton, Ohio. Okay. I've driven through it, but I'm not really that familiar with it. You just get immune to that after a while when you see those gunshot wounds to the head?
You don't get immune to it. You when you're in the act of treating things, you don't get emotional about it. But there's no way you can see those things. In fact, I got out of emergency medicine because I just got to the point where I couldn't believe what other people did to other people.
Yeah.
And it got to be kind of a sad thing. And then the reason I got out was one night on a Friday night, two gangs came in. They'd been fighting at a bar, but both the gangs were all beat up and injured. They came to the same hospital, started fighting in our emergency room. And the police had to come. We got all the patients locked in another room, and they knocked each other out. But the police handcuffed them to our beds because they were all bleeding and having. And so I spent the whole night repairing all these guys so they could go off to jail.
Yeah.
And I was like, this is getting dangerous.
Yeah. Yeah, you're not going to run into that here. So have you done many wrestlers or
Oh,
fighters or athletes? Yeah.
Oh yeah, one weekend we did a Friday, Saturday, Sunday. We did 150 stem cell injections on arm wrestlers,
Oh wow.
shoulders, elbows, wrists, thumbs, all that.
Wow.
So yeah, I've done a lot. Plus, in my practice, I did thousands of joint injections and things like that, steroids, that sort of thing.
How far are things coming along in recent years as far as being able to fix stuff without surgery?
Well, I see some pretty miraculous things these days.
Yeah.
A lot of studies going on. Okay, so we're going to go right here where I found that notch. You're going to feel a sting now.
Yeah. Oh yeah.
Bear with me. A little bit to the side. Okay, we're almost there. We're in. All right. You'll feel some pressure.
Okay.
Because we're putting a couple cc's in this small space here.
Oh yeah.
All right, we're done. You did well.
Thank you.
Get a little ache from that?
I did when you took it out, but it's not too
now.
bad.
Yeah, usually once it's when we're in there putting that fluid in.
Yeah.
We put a little Band-Aid on you. Yeah.
Jenni was saying you guys are having a deal for wrestling fans next weekend too, or something here.
Yeah, I think, is there like a big wrestling thing?
Yeah, WrestleMania. I don't know if it's next weekend, but the next couple
Yeah,
weeks.
I'm not sure what she told me about it, so.
Yeah.
Okay. Good. Now, I'm probably going to have you lay down for this heel.
Okay. No problem.
Place your hand back here. Let me pull this out for your legs.
So how long have you been out of Ohio for?
4 years.
Okay. Oh, so it's still fairly recent.
Yeah. Okay. Now, when they've injected you in the past,
They put some on both sides of it. They put like half on each side.
right? Yeah, is that
It's still
painful?
very yeah.
I can
It's a
imagine.
really annoying injury. By far the worst injury I ever had.
Well, and the problem is, you injured a point that supports your entire body weight.
Yeah.
So feet and ankles and heels, those injuries are tough. Very tough.
I'm even thinking of, since I had it done in Canada, I know you guys have some of the best ankle surgeons, and someone recommended me one in Atlanta. I'm even
Yeah.
thinking of having one look at it and say, is there anything else that can be done? Because in Canada, they're telling me this is as good as I can get, which I just find that hard to believe. Because looking at it to you, do you think that's as good as it could get from a surgery?
The problem is, you have what's called a comminuted fracture. Man, it was like crushed into pieces.
Right.
And they put those screws in there to hold the main pieces together.
Yeah.
But the rest of it had to heal. So, some of those bones may be, the union between them, may not be as strong as the others. So you get a little, even though it's healed and intact,
Yeah.
it may move a little bit, which causes the chronic pain.
Okay.
Yeah, I mean, when I looked at it, I was like, whoa, that's a bad one. Did you have an infection or anything back here?
Yeah, I did. Yeah,
Okay,
I actually was on IV antibiotics for six weeks.
Yeah, it looked like you had an infection there.
I had to wear that thing around my neck that sucked the poison out.
Yeah. Yeah.
I'm glad those days are over.
Well, yeah, that's definitely a hassle to go through all that.
Yeah.
IVs, pick lines, all those kind of things.
So for the foot, what would you imagine a stem cell would help with in a case like this?
So you obviously most of the healing is done in there.
Yeah.
But if there is any areas where the bone's not strong enough, or where the union of the fragments wasn't strong enough, then it may improve, because these stem cells, the theory is that they can actually turn into bone cells in this case.
Okay.
So just solidify that.
Okay.
Okay. Do this side first, and then we'll kind of flip the leg over a little bit there. This is going to be.
Oh, I know. Yeah, I know.
Yeah, this is not going to feel good here.
No,
Okay.
All
right, sharp stick.
Yeah. Oh boy, yeah.
Okay.
Why I didn't get myself something before I came here, I don't know.
You'll feel pressure here.
Yeah. Okay. Well, it's good practice for wrestling, right? Pain tolerance. Look at it that way. It's a little more intense than the shoulder.
It's going in the right place, good. So it'll kind of coat all those areas there. You did a good job with that.
Now, is the exosome mixed right into that, or is that a separate?
It's mixed right in, yeah.
Oh, perfect.
Yeah, no, one shot.
Yeah. Okay.
He's in there. I gotta go through this again.
Yeah, that's what I was wondering.
I'll hold just a little pressure. Put a little Band-Aid on there. We'll flip it over. Okay.
Okay.
You're a good patient. These are not pleasant procedures.
Well, I'm filming you, so I gotta pretend I'm tough.
Yeah, I don't know. Sometimes doesn't matter how big, how strong, it still hurts.
Oh yeah. The butcher knife to the chest. Did it penetrate the heart at all? Or?
No. Just lungs. We had to put chest tubes in. Interesting thing was he walked in the emergency room with his knife sticking out of his chest. It was like 3 a.m. I was the only doc in there, and he had a coat on over it. He was kind of bent over, and I said, "What's the problem?" He turned around and showed me, and I'm like, and then he collapsed. I don't even know how I made it to the emergency room, but.
Oh God. So I guess you get an adrenaline rush when you're like, oh my God, it's now up to me to save his life.
Well, you kind of get trained though to. There are things you have in your head, like, remember, the patient is the one with the problem, not me. I have to be calm here,
Yeah.
Okay, I'm going to kind of roll you back the other side there.
How do you like Vegas compared to Ohio as a city?
Oh, I like it a lot. Yeah, I actually lived in Indianapolis, Indiana. I did my training in Ohio. But,
Okay.
Yeah, so I used to come out here all the time, though, medical conferences, things like that. But I moved out, my wife and I moved out here because my grandkids live here. So we, those little screws give me a lot of reflection there.
Yeah, at one point they were thinking of taking them out, but they decided
Leave them in
they
there,
didn't
just
want
keep it stabilized more.
Yeah.
Yeah. Oh, there they are. Okay. Pretty much the same thing on this side.
And how do you know Dr. DiCaprio?
Well, when I was looking for something to do out here, I was kind of intrigued by this. I've done a lot of reading on regeneration and stem cells and studying it, things like that. So I met him when I kind of talked about coming to work here and helping out. And I met AJ quite a few times, and Jennifer I spent a lot of time with, and good people,
Yeah.
helping a lot of people.
Oh yeah. Yeah, they're saints.
All right.
Here we go.
Other half. This may be a little more uncomfortable over here.
Well,
Hang with me here.
all right.
Sting now.
Okay, yeah. I'll just sing along.
You have
It
a
helps
lot.
the pain.
You have a lot of scar tissue in here.
Yeah, holy moly, yeah.
Pressure now.
Yeah, next time I'll take an Advil before I come. I don't know what the hell I was thinking. Ooh.
Almost done here. I'm gonna kind of go in a different direction though.
Yeah. Holy.
Hang with me.
Yeah.
This side's got a lot more scar.
Yeah. Oh God. Yeah, it's painful that side. Holy. Oh my God, it's so painful. That's really painful.
Okay. Almost done.
Yeah.
All right, this is the rest of it here.
It's okay. The fans that don't like me to see this, they'll enjoy it.
So you have quite a social media presence.
Yeah, I think we got 428,000 subscribers for our YouTube channel. No.
Okay, all done.
Oh.
You can breathe.
Oh yeah, that was painful. Oh.
That's a
And guys, if you're thinking of getting this, the shoulder was a lot less.
Shoulders are
The
bad.
shoulder was a lot less.
Feet and heels, very uncomfortable. Plus, because you've had so much surgical work, so much scar tissue,
Yeah.
you had the infections in there. The needle has to go through all that tissue, and it's really thick in there.
Yeah.
So, plus, good news is you got a great blood supply down here.
Oh yeah, it's bleeding well.
Oh yeah, well
Yeah.
that's good.
I've always been known for that.
Yeah, that's good though. That's not a negative.
Okay, that's good.
You're not bleeding much, but
No, but
good
yeah.
supply. Yeah.
Do you think the stem cells will help at all getting the feeling back in the toes? Because I did lose some.
I mean, in
feeling.
theory, the stem cells should improve nerve function, should improve tendon ligament function, should improve bone healing, all those types of things. I mean, these are blank cells designed to become, the cells that they're in contact with and the
Right.
environment they're in. A lot of studies going on with that. So these are umbilical cord stem cells we use here. So they're brand new, fresh cells. We know that, of course, in the United States, we don't use embryonic stem cells from embryos.
Right.
And some countries do use that, Panama, things like that. They've been shown to become other cells much more readily than umbilical stem cells have been shown to do that. If we take stem cells out of someone my age
Yeah.
and then put them back in, they have less likelihood they're going to become other cells.
Okay. Is Colombia one of the places where they can get the embryonic ones?
Probably. I'm not real familiar with the Colombia. I've talked to quite a few docs and patients from the Panama area.
I guess it's just the medical rules are more lenient there.
Yeah.